Why haven't you come to see me? Those are the heartbreaking words thousands of Wisconsin families have heard from loved ones locked down inside of nursing homes.
Fox 6 investigator Brian Polson shows us why it's an especially confusing time for seniors who keep asking that question because they don't remember the answer.
Good morning.
Good morning, Mom. Can you see me?
Yes.
Caring for a parent in decline is hard.
Your nails look so pretty.
What?
Your nails look so pretty.
Watching it happen from the other side of a screen, agonizing.
You worry that she wakes up on a given day and goes, well, I wonder why I haven't seen my daughter for a while.
Yeah.
Mary has dementia and lives in a memory care unit at Kirkland Crossings in Milwaukee.
I just have a really hard time leaving her there.
Thanks to the threat of COVID-19, Nancy Brundage hasn't seen her mother in person for weeks.
I'm afraid I'm going to take that as questioning.
Instead, she just stares at her mobile phone,
Just time's out.
hoping to catch a glimpse of the webcam she installed before the lockdown started.
Hi, Mary. I'm going to push you out in the hallway to your lunch, okay?
I'm just so consumed by this these days.
Others, she knows, don't even have this.
You sometimes already feel like you're on borrowed time.
Kate Kalis is with the Alzheimer's Association of Wisconsin, which counts more than 120,000 seniors across the state with dementia, many of whom are locked down in nursing homes, cut off from family.
They oftentimes have to be reminded multiple times why this is happening.
The closest they might get is a window visit, but for some, that only adds to the distress.
Because they don't understand why their family can't come in. They think that their family is choosing not to come in.
Nancy sometimes drops off supplies, but she can't go in. And no matter what she sees on her webcam, she feels helpless to intervene.
I see her sitting in her wheelchair more than I'd like her to sit in her wheelchair.
Is showing that the staff is overwhelmed.
And that's why Mike and Nancy Brundage are pleading for a change.
They really do need an advocate.
They've asked the nursing home to clear one family member per resident to visit, as long as they agree to follow the same safety precautions as the staff.
Whatever the protocols are, I think that any family member would go through them, to be able to be the advocate for the person that they love.
But public health experts tell Fox 6 News the risk is simply too great for a population so vulnerable. And the administrator of Kirkland Crossings writes they plan to continue following state and federal guidance prohibiting non-essential visits to keep their residents safe.
I want them to be safe, but on the other hand, I want her to have a good quality of life.
If there's one silver lining for Nancy, it's that her mother may not remember all of this.
I think of you all the time. Wish I could be there.
But the heartache of their forced social distance
All right. I love you too.
is something she will never forget.
The state's Safer at Home order expires on May 26th, but that doesn't mean nursing homes will allow visitors to return at that time. It's still unclear when that will happen. And for Nancy Brundage and so many others like her, they're just not sure what will be left of their loved ones' mental faculties when that time comes. In Milwaukee, Brian Polson, Fox 6 investigators.
In a statement to Fox 6, the administrator of Kirkland Crossing writes they've had 0 cases of COVID-19 in their facility, and they intend to do everything possible to keep it that way. She says they do facilitate video chats and encourage window visits. And while it's been a challenging time, she writes it has not overwhelmed their staff. You can see their complete statement at fox6now.com.